Hi everybody, this is Dr. Batash, and today we're going to be discussing revisional endoscopic procedures for patients who've undergone the gastric bypass surgery and unfortunately have defeated the procedure. What you are seeing here, someone who has undergone the gastric bypass, and the most important part of the gastric bypass is the connection between the tiny stomach remnant that the surgeon leaves, the connection to the small bowel. And we're looking at the stoma. At first, the stoma is very, very narrow, and that's what contributes to the weight loss. With time passing, and if the patient is overeating, the stoma dilates, and once the stoma dilates, it allows for regain of the weight. Now, the way to fix this would be another operation, which is fraught with a lot of complications and increased surgical difficulty, technical. So what we do is endoscopically, with sutures alone, we take the stoma, or this opening, and we narrow it down with sutures. So essentially what we are doing is we are restoring to the patient the same size connection or stoma that the patient had right after the surgery. This procedure is extremely successful, and it allows us to restore to the patient the weight loss that they have lost after the surgery. So if you are someone who has undergone a gastric bypass and initially lost an adequate amount of weight, and now unfortunately you have regained the weight, we can take care of this endoscopically with suturing alone without resorting to a second operation. We can narrow down your stoma back to its original size and get you back the results and the weight loss that you need.